Hello, good morning, good afternoon, and good evening, depending your location. Welcome to this early broadcast. Good morning, good afternoon. How are you guys doing? You are welcome to today's program. You are welcome to today's program. How are you guys doing? Is my audio all right? I believe you guys can hear me. I believe you guys can hear me. How are you guys? How are you guys doing? Julie, you are welcome. How are you? Good morning, Julie. How are you doing? How are you? You have any question for me this morning or this afternoon? All right. Let's wait a little bit. Let's wait a little bit for everybody to come online. I'm working from home today, so I'm going to have my all right. I'm working from home today. My attentions are going to be divided. Regina, my apologies yesterday. Regina, my apologies. Yesterday, I was on the call when you tried to come online on the video. So that is why I did not ignore you. Please, my apologies. All right. You are welcome. Regina, Imam, you are welcome. Julie, I've acknowledged you. So, Regina, my apologies. Please, please, please. I did not ignore you. All right. Still, I'm going to share the link. I believe you guys have the link. Those that have the link, if you want to come on the, if you want to come, if you want to join the live program, you can click on the link. I'm going to place the link once more again. All right, this is the link. All right, anybody who wants to join the live program now, who wants to come on the video and ask a question or contribute, can click on that link. Okay, first of all, you have to download that link in your phone or in your laptop, in your browser. You have to download it, open it, and then you'll be able to join the program. So you have to save that link. Okay, you have to save it in your phone, in your laptop, or in your computer. Okay, you have to download it and save it. So anytime I'm live and you want to join the program or you want to ask your question live, you can now click from that app and then I will bring you in to ask your question. All right. So that's the link. Okay. Inam, how are you? You're watching from Pakistan. Julie says she's not feeling well, not too well, doctor, stomach pain. What did you eat last? What did you eat? Do you have any? Did you eat any expired food, contaminated food? It could be food poisoning. Julie, why you are having stomach pain? Is there any issue with All right. What are you? Do you have any food poisoning? Do you have any? You might have eaten something that have caused you to have stomach pain. But try to take some. Um, what should I say? Sometime when you eat a cold food, that's why sometimes you must warm your food before you eat. Do not always eat cold food. Sometimes you must warm your food to a very good temperature to eat those foods. Sometimes when you eat a cold food, it's going to upset your stomach. Or when you eat a expired food, it's going to upset your stomach. So try to take some lemon tea. Okay, take some lemon tea and see if it's going to be okay. But it depends on why you're having stomach pain. Maybe you might be having cramp. All right. Regina says, which milk is recommended, full cream or low fat? Regina, I've said this several times. Okay, anything milk, stay away from milk. Whatever name, I've said this several times. I don't know why you guys don't listen. All right, I've preached and I've said this several times. Stay away from milk. It doesn't matter whatever name it is. Milk is milk. Milk has a lot of fat in it, a lot of carbohydrate in it, and a lot of sugar in it. I don't know why, especially people in Africa, they like milk so much. They like milk so much, and that is why they keep getting sick. Stay away from milk. It doesn't matter whether the milk say is low fat, no fat, skim or no skim. Stay away from milk if you're a diabetic. Okay? Stay away from milk if you are a diabetic. You don't need it. Okay? Especially people from Africa, they like milk. Even if they are dying and they tell them, stop taking milk, they will still like to take milk. If you're a diabetic, stay away from milk. Milk contains a lot of fat, a lot of calories, a lot of sugar and carbohydrate. It doesn't matter whether it says a skim milk or half that. It does not matter. Stay away from milk totally. All right. Let's go to Julie. I don't have a regular gallbladder and the pains is coming from my right side. Oh, well. Have you seen a doctor? Have you seen your doctor on this issue? Have you seen a uh, have you seen a doctor on this issue of gallbladder? Okay, that's all. That is what I wanted to suggest now. That is what I wanted to suggest now, that you have to go and remove it. I hope it is not tumor. I hope it is not tumor, right? Okay, all right, okay, all right, okay, all right. The most important thing, I believe it doesn't have any tumor in it, right? Gallstone, okay, okay, that's fine. That's fine. Because the tumor is the one that is dangerous. So gallstone, you're okay. Because it's going to, when you have a gallstone, it blocks the flow of bile from the bile duct. And because of the blocking the bile ducts, it causes you to have an inflammation and pain. Those inflammation and pain is what causes you those pain. Okay, gallbladder can be treated. Once you get it early, it can be treated through surgery removal. So since you've done the removal, you're on a safe hand. That is good. That is good. All right. I thought the tumor is the one that is dangerous. So since it's just a gallstone, you're okay. And the medication you are taking is fine. omeprazole is fine. So that's okay. I hope you get better. I hope you get better. No, gallstone could be as a result of several things. Okay, that is why I asked you: does it because when they remove the gallstone, they have to go and test it for tumor to see if it is cancerous. Okay, once they remove it, they go and test it to see if it is cancerous. And once they say it's not cancerous, it's just a gallstone, then you know you've cleared the first stage. Once they say it is not tumor, it is not cancerous, at least you know you're on a safe path, because the tumor aspect of it is what is dangerous. Now, there are gallstone, okay, when you have gallbladder issues, it could be it's a series of different factors. It could be a severe illness, maybe you have a severe illness, underlying illness, or infection. But the main causes of gallbladder issues are when your bile is blocked. There's no flow of bile from the bile duct, and when that bile duct is blocked, there's no flow of biles. Okay, then it causes. Yeah, they are going to test it. Okay, yeah, they are going to test it. Okay, that is the gallbladder is the gallstone. Okay, the gallbladder is the gallstone they remove. Okay, they are going to test it to see if it has any tumor. Once it comes with a tumor, they're going to test it if it is cancerous or not. But in your own case, they remove the gallstone. Okay, the gallstone can be treated. It is treated through surgery. Why you're having a gallstone is because your bile is blocked. There's no flow of bile from the bile duct. And because the bile is blocked, there's no flow, it causes inflammation and pain. That is why you're having that severe pain. Okay. Lucy, welcome. That is why you are having that severe pain, because the bile duct is blocked. There's no flow of bile. So you're having an inflammation, and then you're having that severe pain. So, but gallstone is treatable by surgery. You've done all the necessary part. You've done the surgery to remove it. You're on, taking a good medications. They're going to test that gallbladder, that gallstone they remove, to see if it is tumor, if there's any tumor in it. If it has no any tumor in it, you are okay. The tumor aspect of it is what causes the maybe to see if it is cancerous or not, if it is benign or malignant. So that is what they're going to do. But there are different reasons why you might have a gallstone. Okay, infection, bile blockage. If you have a bile blockage, it can cause you to have an infection. All right. So those are the reasons, but it doesn't. In terms of liver, you're having your pain. Sometimes, are you having your pain on the side or in front of your abdomen? Good morning, Pelon. Are you having your pain in front of? Are you having the pain in front of your abdomen on the side? Okay, because your gallbladder is beneath your liver. Okay, your gallbladder is beneath your liver. Now, excuse me. Jesus. I'll be right back. Just trying to sort one of the things out. Okay, so let's Patrick, you're okay. Bridget, you're welcome. So let's go to now. Let's look at the risk factors why you are having that gallbladder. Okay, and maybe I'm trying to deviate. Let me just try to answer your question because your gallbladder is beneath under your liver. Now, the risk factor why you might have increased risk of having a gallstone or gallbladder issue is if you are female. Mostly female have that issue of gallstone. Female has that issue a lot. Let me remove these things. The risk factor why you might have a gallstone issue or a gallbladder issue is one, being female. Female always have that problem. If you are age 40 or over, okay? If you are age 40 or over, okay, and being overweight, okay, being overweight, obese, okay, being pregnant, okay, eating too much fat, okay, eating too much fat, high fat food that contains high fat diet, and eating a high cholesterol diet, okay, and you don't eat enough fiber. Instead of eating enough fiber, you're eating low fiber and much more of cholesterol, okay, and then having family history of maybe you have family history of gallstones now, or you have a diabetics. So diabetes can also contribute you to have a gallstone or gallbladder issues. Issue of sickle cell anemia or leukemia, okay. If you are losing weight too much, unexplained weight loss can also cause you to have gallstone issue. Taking certain medication can also cause it, and then having a liver disease. If you have a liver disease can also cause you to have a gallstone issue because your gallbladder is located beneath your liver. So these are some of the issues or some of the risk factors that can expose you to have a gallstone or gallbladder issue. Now, why I was so concerned if it contains tumor is that why I was more concerned, okay, if it contains tumor is because we have something we call gallbladder cancer, okay. As they remove that gallstone, they have to go and check it to see if it is cancerous or not. But it is rare, okay. It's 1 in 10 because gallbladder cancer is rare. It's only 1 in 10 people that always have that issue. It's rare for you to have a gallbladder cancer, but the process have to be taken. Once they remove it, they have to go and check it to clear it up that it is not cancerous and put it on your medical record, but it is rare. It's 1 in 10. It's not something that always occur. Like, we have a cervical cancer, breast cancer, prostate cancer. This gallbladder cancer is rare. It's 1 in 10. But they have to go through that process. They cannot just remove the gallstone and throw it away. They have to go through that process to test it for tumor, if there's any presence of cancer or not. Now, I'm trying to change my topic. Not now. I'm going to go back to my topic, but I'm trying to answer that question. That is what I've asked you guys to make sure. Peter, I've seen what you are sending to me. All right, I'm going to respond to it. Okay. You've sent 3 questions. I've seen them, so I'm going to respond to them. So just hang on there. All right. 1, 2, 3. So on the gallstone, all right. On the gallstone contains a lot of cholesterol, and that is why I've said it several times. Make sure, okay, exercising is very important. These are certain things that exercise should have taken care of. I've said it yesterday when we were doing a live video. I said exercise, when you are physically active, exercising is going to solve 50% of your health issues. It's going to solve 50% of your health issues because exercise is very important. Like gallstone contains a lot of cholesterol because remember that bile, that blockage of bile, okay, contains a lot of cholesterol. There is an important role cholesterol plays in your system of your digestive because that cholesterol, okay, due to that cholesterol plays a role in producing that bile that you need in your digestive issue. So when there is a blockage of bile from the bile duct, it is not getting to your digestive issue. You are not having a very the fluid is not reaching your digestive issue to digest most of your food. You start having that inflammation and pain. So cholesterol also has advantage and disadvantage, but it plays a vital role. But now you have to exercise. If you are someone that exercises a lot, you might be escaping all these issues. We have two type of gallstone issues. We have cholesterol gallstone, and then we have the pigment gallstones. The most common type of gallstone called cholesterol gallstones often appears yellow in color. Okay, this type of cholesterol gallstone appears yellow in color. They're composed of mainly undissolved cholesterol, but contains a lot of components. This cholesterol gallstones is yellow in color. Then the pigment gallstones is dark brown. So there are two types of gallstones issues you might have. Either you have the cholesterol gallstones or you have the pigment gallstones. The cholesterol gallstones is yellow in color, and the pigment is dark brown. These have to differentiate both of them. All right. So I don't want to go into it too much, but it could be a sign of. Let me see something here. Hold on, I'm trying to put something in. I'm trying to, there's something I want to share with you guys here. So just hold on. I'm trying to do something. All right, Lucy, Julie, there's something I pasted there, the risk factors. So let's not, I think that will help you. But to answer your question, you asked a question if it could be a sign of liver disease. Yes, it could be a sign of liver disease, but the most important thing is that tumor aspect of it. That is why the first question I asked you was, is it tumor? Does it contain tumor? Tumor is the scary aspect of it. If they say it does, the tumor, there's no tumor in it, at least you know that worriness is gone. Now, the liver aspect of it, okay, is a risk factor of a liver disease. But now you're a diabetics. And that is why I've said it several times. If you don't control your diabetics issue, these are the complications. Okay, if you are not dealing with your diabetes situation, get hold of your diabetes, control that sugar very well, maintain it there to avoid all these side complications, because diabetes can also cause you those complications for you to have these gallstone issues. So if you control your sugar level, do those things I ask you guys to do, they should be worried about your liver. Now, when you see your doctor, anytime, Judy, anytime you see your doctor, try to see if doctor can recommend you some medication to protect your liver and your kidney. I don't know the stage of your liver now, the functionality of your liver or your kidney, but make sure you get some medication that can protect your kidney and then your liver. All right. As long as this your gallstone issue has not any interference with your liver. Where I'm mostly concerned, I'm not even concerned about your liver issues. I'm only concerned if that gallstone contains any tumor. So you have to find out. I don't know in Guyana the process there. I think you're just going to take the gallstone out and just discard it. But here, once they remove that gallstone, they have to take it and check if there's any tumor in that gallstone to see if it is cancerous and or not. They have to rule everything out. Okay, so I don't know how it goes in there, but try to have a discussion with your doctor to find out if there's any further test done on that gallbladder gallstone that was removed. And again, second thing, try to see if you can get a medication to protect your kidney and liver. And make sure the third one, make sure you handle your diabetes situation, very important, because these are the complications you are going through now. All right. So, Julie, I believe I've shed more light on your issue. So let's go to Bridget. Bridget, you're watching from Zambia since. You're watching from there since I started taking metformin medicine. I have noticed that my right shoulder pains a lot. Bridget, if you are taking metformin and you are having some side effect, okay, if that side effect lasted for 7 days, go and see your doctor and discuss your side effect of that metformin with your doctor to see if he or she can recommend a new drug or reduce the dosage or investigate more why you are having that severe side effect. So what we are going through now is a side effect of metformin. I would advise you to go back to your doctor and discuss that side effect with your doctor, that this thing has lasted for 7 days or more. Can he recommend another medication or see what he's going to do? Some medications some medication want to work, you have to pair them with another medication to have an effectiveness. Some medication don't like to work independently. You have to add another medication. So these are the things your doctor is going to review with you and see, should I change the medication with you? Should I add another one or should I reduce the dosage? So what we are going through now is a side effect of the metformin. So I would advise you to go back to your doctor and discuss that side effect with him or her and see what they can come up with. It's either they add another medication, reduce the dosage, or change the medication entirely. Okay, Bridget. Let's go to Patricia. Patricia says, Julie, did you hear what I said? Did you hear me properly? All right. Now, let's go to Patricia. Patricia says, let me see what Patricia says. Is it in order to stop medication such as Daranil, metformin when you have managed to control your sugar levels through diet and exercise? Patricia, are you still there? Can you confirm to me if you are still there before I answer your question? Patricia, can you confirm if you are still there? Chikope, I need you to confirm before I answer your question. Are you still there? Because some people will just ask a question and they will disappear. They won't be there to get an answer. And then they'll come back towards the end of the program and say, oh, doctor, you didn't answer my question. So, Patricia, are you still there? Before I answer your question. Okay. If I didn't get any response from you, I won't be able to answer your question. It means you are not listening. Until you confirm that you are here, then I can answer your question. Patrice, is it Patricia or Patrick? Patrick. Patrick, you have to confirm that you are here before I answer your question. Otherwise. All right. While I'm waiting for Patrick to confirm before I answer his question, let's go to today's topic. What I'm trying to discuss about your drinks. I was trying to discuss before I think this gallstone, I'm going to make a video on this gallstone. I'm going to discuss it in another time. We're going to dive into more gallstone issue. Now, I believe all of you have the link. I believe all of you have the link that I posted there. If any of you wants to join the program live or ask your question live on video, I posted a link. I said you guys have to save that link, download it on your phone, on your laptop, on your iPad, save it on your phone. So anytime I'm live, you can, through that app or whatever you download, you can click, follow the instruction to enter in the studio to join. Okay, so anybody who wants to join the program live can follow the link I shared, download it on your phone, on your iPad, save it, and then follow the instruction how to enter. And if you want to ask your question or share is your diabetic situation with me, you can use this link. I'm posting the link again. That is the link. You have to save it on your phone, on your iPad, or your whatever, download it, open it, save it there. And anytime I'm live, you follow the instruction there, how to enter the studio, how to enter the so let's go back to what we are discussing on drinks diabetes can have. I believe I've discussed this issue before. I think this is my second time I'm trying to do it again. If you're a diabetics, okay, doctors, once you're a diabetics, doctors will recommend the type of drinks or the type of food. The first time you're diagnosed as a diabetes, doctors, it's an obligation of any doctor to advise you in terms of your dieting, what you are supposed to do, dieting, what you're supposed to eat, drink, exercise, reducing your weight, and then your medication. So if you're diabetes, doctors do recommend drinks that have no calories or low calories or even no sugar at all. They advise you what to do drinks and what not to drink. Brian says, what is the name of my YouTube channel? Is the same as my Facebook channel, Managing Diabetics TV. Managing Diabetics TV is YouTube name. All right. So, Patrick, I'm still waiting for you to confirm if you are still here for me to answer your question. So, if I didn't get any confirmation, then it means you are not listening. So, there's no need of answering that question. So, as I was saying, doctors always advise you recommend the type of drinks, the type of food to eat initially when you are diagnosed as a diabetic. It is an obligation of every doctor to advise their patients once they are diagnosed as diabetics on which route to take, what to eat, what not to eat, what to drink, and what not to drink. Exercising, reducing their weight, and then medication is also very important. So doctors always advise new patients diagnosed with diabetes, even on a consistent basis. Anytime you visit your doctors and then the numbers are not making any sense or they are getting worse, doctors will keep advising you that you are still not following instructions in terms of your dieting, because your numbers, instead of your numbers looking good, they're looking worse. So the numbers communicate to the doctor if you are doing certain things wrong or if you are doing certain things right in terms of your diabetes management. It's all about living and managing your diabetes. So, and that is why, as I was talking to Regina about drinking milk, make whatever name they put at it, make your milk. I don't give a damn whatever name they put on that, make your milk. Whether it's skim or unskim, 50 or half, whatever it is, stay away from milk. I've challenged everybody, either on this program or outside this program. I've challenged everybody to show me one milk. Show me one milk that says no sugar, no carbohydrate, no calorie, no fat. Somebody should go and get me that milk that says this milk is meant for diabetics. It doesn't contain sugar or anything added on it. No calories, no fat, no carbohydrate. Even those milk they say is 0% still contains carbohydrate, still contains fat. And that is why if you consistently take milk for 1 week, just 1 week, just continuously taking milk for 1 week and see if you're not going to add weight, your waistline is going to increase, your tummy is going to increase, because milk contains a lot of fat. Even those they say contains skim milk, they contains a lot of fat. So that is why I say diabetics, you stay away from all kinds of milk. It doesn't matter whether milk or no milk, you stay away from it. Because at the end of the day, it's going to worsen your situation very well. So diabetes doctors are going to recommend to you initially on the type of drinks, food to eat. Okay, so you're going to be aware when taking certain drinks. You're going to be aware the kind of drinks you take, what to eat, because it is important to know the number of the carbohydrate you consume. And that is why I've said it even yesterday when we were doing a live video. I said the problem all of you or everybody is having here is you're taking your medication, you are taking your medication over a period of time, you've done everything you want to do, but why is it anytime I go for a test, instead of my numbers looking good, they're looking worse? Because you are not taking into consideration the number of carbohydrates you are taking in. You must understand the number of carbohydrates you take in per meal and per day. Carbohydrate is the issue why you are not handling your diabetic problem. Okay? Even though you stop putting sugar, stop buying sugar from the market, you're not buying any sugar anymore. That is the tiniest aspect of diabetes management. Not stop taking sugar is the tiniest problem of your diabetics. The most issue is that all kinds of food and drinks we eat contains carbohydrate, and that carbohydrate is same thing as sugar. So even though you are not in your house, you've cleared your cupboard of sugar. No, you can't find any trace of sugar in your house anymore. Hey, children, no more sugar in this house. I'm diabetic, no more sugar. Fine, fair enough, you're doing the right thing. But most of the food you are eating contains carbohydrate. 99% of most of all the food contains carbohydrate. And the same that carbohydrate is same thing as sugar. When you have it out in your kitchens, they are carbohydrates. As soon as you consume those things, your body starts breaking them down faster to convert into glucose, and then still cause the same damage sugar is causing. So understanding the number of carbohydrates you take per meal per day is the beginning of managing your diabetes very well, because that is why all kinds of medications, you can take all kinds of medication, but if you are not mindful of the carbohydrate intake you are taking, still you are taking your medication, but at the end of when you go for a test, your sugar level is high because you have not yet mastered the art of counting your carbs. Okay, so you have to be wary of the kinds of drink you take. You have to be wary of the kinds of food you eat, because remember, every food you eat, virtually every food we have out there contains carbohydrate. Now, being diabetic does not mean you don't need carbohydrate. That is why they gave you 15 grams of carbohydrate per meal. As a human being, we need carbohydrate. That carbohydrate is that is what supplies us that energy that we need. Without carbohydrate, no human being is going to survive. And I've said it several times, any diet that does not contain carbohydrate is not a balanced diet. It must contain carbohydrate. Even though you're a diabetic, you still need that carbohydrate, because that is what fuels you the energy that you need. But now you have to know how to count the carbs to eat your carbohydrate in limitations and then increase the intake of your fiber. All right. So we have to, it is crucial to know the number of carbohydrate you consume and how they may affect your blood sugar level. Okay. So when you have diabetics, it means you have to be aware of everything that crosses your path. Don't just, when you are not diabetics, anything that comes to your path, you buy. Oh, you buy. You are in the bus stop, you buy. You are in the car, you buy. You are in the street, you eat. Everything good. Yes, you are not a diabetic. You can eat anything you want to eat. But once you're a diabetic, everything that crosses your table must be taken into considerations. I'm diabetic. Is it going to affect my sugar level? You must not be tempted. You must evaluate. What time do you? The last time I eat, what time do I eat? When is it going to be my next meal? Okay, what is the carbohydrate? Because any slight addition to what you've just eaten before will increase your carbohydrate and worsen your situation. That is why everything that crosses your path as a diabetic must be taken into consideration. Does it affect your sugar level? Because it contains carbohydrate. Even if it's a peanut, just one peanut will make a difference in spiking up your sugar level or making it worse. But when you are not a diabetic, that's a different thing. But once you're a diabetic, you must be aware of everything that you come across to eat or to drink. Let's see what Brian says. If you have managed to control your sugar through carbs, control, and is it right to stop drinking your medicine? Brian, I don't know. This question was asked by Yvonne. Good morning. This question was asked by Patrick, and Patrick did not answer. That's why I did not answer it. So, you're asking the same question. Are you the same thing with Patrick, Brian? Because he asked the same question that I was actually I was mentioning. Is he here for me to answer that question? But you answer. I don't know if you are the same person with Patrick, because he asked me the same question. So now, since you've asked the same question, since you are still here, Yvonne, you're welcome. For those that want to join the program live, I share the link. So you guys, if you want to join the program live, you can follow the link, download it in your phone, open it in your browser, and follow the instruction on how to join the program live. And I'm going to bring you in to answer your question. I'm not Patrick, because I'm okay. All right. Okay, I'm going to answer that question now because both of you are asking the same question. Brian says, if you manage to control your sugar through carbs, control, and exercise, is it right to stop drinking your medicine? All right, what I'm trying to say is, okay, there are thousands and millions of people who are not on medication. Right from day one, they are diabetic. They are living normal life, no issue, no complication. The way they control their diabetes is through exercising and dieting. These two, that is what I say to you guys. This exercise can solve 50% of your diabetic issue. Like me, I exercise. Before I start this program, I've been to gym. Like I'm working from home today. I've been to gym and I'm back and I'm doing a live program with you guys. And when I finish my program again in the evening, I have to go back to gym again. You got to be disciplined. I'm rarely on medication. I only take my medication once in a while because my exercising takes control of the whole issue. I shared my lab result with you guys. You know, there's one video I posted. I shared my result. You could see my result. Everything is normal. Because anytime I go and do my A1C test every 3 months, I'm not scared of anything because I already know how the result is going to come out. Okay? Exercising will take 50% of the problem out. You might go 2-3 days without even medication and still be okay because that exercise alone is going to take care of the situation. So there are millions of people who are managing their diabetics through exercising and again dieting. Now, if you are exercising, you must balance your exercise with dieting. It's not just exercising and then you come back, you sit down in your couch and then you eat one bowl of cornmeal. That's a waste of time. If you are going to handle your diabetes with exercise starting from now, you must balance it with healthy dieting. Count your carbs, eat a lot of healthy food, vegetables, and then more fiber. All those things must be. It's not a choice. You must balance your exercising with healthy dieting and follow those instructions for you to stay out of medication. There are millions of people who are doing that. They are not on medication. Why? Because not everybody can afford. Diabetes is one of the most expensive medications to treat it. It's expensive. Not everybody can afford a medication if you don't have insurance or if your government is not subsidizing those medications. So those that cannot afford it, choose the liver way. Doctors are going to give you an options. Do you want to manage your diabetes by yourself, or do you want me to prescribe medication? They're going to give you opportunity. If you say by yourself, doctor is going to leave medication. I say, okay, I'm going to monitor you and give you an appointment to be coming in. Let me be checking your sugar level, your A1C level. So yes, you can manage your diabetes without being on medication through exercising and dieting, but you must balance your exercise with dieting. It is a must, not a choice. Now, if you can also do both, exercising, dieting, and be on medication. Now, if you're on medication and also you are exercising, and again you are taking your healthy eating healthy and your medication. Now, when I talk about dieting, you must stop patronizing fast food joints. So if you like patronizing all those fast food joints, you gotta stop. So there are prices to pay Eating healthy is very expensive. And I've said to you guys, if you're diabetics, make sure you prepare 80% of your meal. Make sure 80% of your meal is prepared by you, because you know your health situation. 20% you can get it from outside once in a while. But if you are going to diet, all those patronizing fast food joints goes away finally. Not that you cannot go to fast food joint. Like I myself, once in a while, I go to fast food joint. But that once, it's not going to kill me. It's not going to make any difference. I'll still be okay. It is when I make it habitual, every time becomes a problem. Once in a while, I go to fast food joint because I know it's not going to affect me. Okay? Once in a while, I will drink. It depends where, if I'm in the countryside where I know that, like I traveled to a countryside. That was we have a long weekend holiday. So I went to the up north countryside. It's about 2-3 hours away from the city. So, it's country, we call it countryside. It's like a village. In the Africa, we call it village, but here we call it countryside. It's out of town. So I lodged in one of the, how do you call it? There's a name they call it. Odd name. There's a name they call it. Okay, I wouldn't call it safari, but it's in the middle of nowhere inside the forest, nice environment, nice call, So I lodged in there. So you could see I'm far away from the main city center. Now, I reached there, and I forgot to take some water with me. I was thinking that, okay, along the way, I'm going to buy a bottle of waters for that weekend. So out of the town, out of the city, I was driving around to see if I can see any shop. I couldn't see because I'm already out of the town. There's no shop around. There's nothing. Luckily, I saw one gas station where I'm going to fill up. Do you guys have water? No water in the fridge. It's only Coke. And I'm thirsty. So I have no choice than to buy Coke and drink. Okay? That Coke, despite it contains sugar, I drink it, but it does not have any effect with me. It doesn't disturb me. It's once in a while. I drink it because I was thirsty. There's no water in that day. I'm out of town, but I was really, really thirsty. So what am I going to do? I said, okay, I grabbed the Coke and I drank it. And there is my sugar level, nothing. Yeah, I didn't have any side thing because this is something I didn't want. Maybe, I don't know when last I drink Coke. I don't know when last I drink Coke. It's over ages. But due to that once, it does not have any side effect in me. It does not spark up in my sugar level. It does not, but that once in a while, it's okay. It is when you become habitual. That's what because. So if you're going to diet, you're going to make sure all these fast food joints, all this food you buy in the street, you got to stop all those nonsense. You got to eat healthy. So you must balance your exercising with eating healthy and your medication. Now, if your medication, all right, if your medication and you are exercising and you are eating healthy, you cannot stop your medication without consulting your doctor. Your doctor is the one who is going to tell you when to stop your medication, even though you want to go on dieting and exercise. So once you've started with medication from the doctor, you yourself cannot stop it. Before you stop your medication, your doctor has to make sure check all the boxes to make sure you are good to go to stop medications. So Brian, you have to, if you want to stop your medication, if you want to stop your medication, believing that you've controlled your diabetes, your sugar level. When I say control your sugar level, you will control your sugar level for 1 month. No, that's not how it's done. No, you can't just say, oh, okay, for this 1 month, my sugar level was okay, now I can stop medication. No, that is not what it's called. For you to be classified as your diabetes in remission has been revised, controlled, you must have 2 years minimum record, 2 years. That 2 years, you must have a clean sheet that for that particular 2 years, your sugar level has never increased or go down, is still within that target range for 2 years. Then doctor can now stop you from medication and ask you to go on dieting and exercise. So not just because you stop your medication for 1 month, 2 months, you say, doctor, my diabetes control, can I stop taking medication? No. Any doctor that allows you to do that, then that doctor doesn't know what he or she is doing. You must have a clean record for 2 good years. Maintain 2 good years record, verified that you've been going on your test, A1C test for 2 years, and each time your result comes back is stable, then doctor can say, now your diabetes is in remission. I will stop your medication, go and. So that's how it's done. So Brian, I believe I've answered your question. All right, Marilyn, good morning. Brian, do you get what I just said? Have I answered your question? My tea is getting cold. Brian, I believe I've answered your question. So let's go back to what I was trying to say before on the type of drinks. On the type of drinks. All right. Okay. So let's go on the drinks you can take as a diabetic. Okay. Now, choosing the right drinks. Marilyn says, I don't use sugar. I'm not a diabetic. My A1C was 5.7 last 8 months. Can I use milk? If you are not a diabetic, you can leave. You can leave. This is scammer here. This scammer that is posting this nonsense here. Okay. Now. All right, let's talk about the drinks. Let's go into the. Okay, first of all, Marilyn says. Let me see what Marilyn says. Marilyn says, I don't use sugar. I'm not a diabetic. My A1C was 5.7. Good. All right, 5.7. Okay. Last month, can I use milk? All right. Marilyn, you are not a diabetic. Your A1C level is okay. All right. Your A1C level is okay, but you're not a diabetic. That does not mean you cannot be diabetic tomorrow. One thing you have to understand, okay, if you're not yet a diabetic, be wary of being diabetic later on along the line. People that have diabetes today is not because they are born diabetic. When I was born, I was not born diabetic. Most of you were not born diabetic, but later on along their life, they become diabetic. Okay? One of the causes of diabetic is the kind of lifestyle you live. One of the causes of why people are diabetic is kind of lifestyle they live. And when we talk about lifestyle is in terms of what you eat, consume, drink, all those things might be a result you become diabetic tomorrow. So if you are not yet a diabetic and you are wary of not being diabetic, then you must make sure you eat healthy. It will still apply to you. You must eat healthy, eat wisely. Okay, you must make the right choice. Not being diabetic does not mean you can take your milk. Okay, you can take your milk, Marilyn, but also that milk contains carbohydrate, contains sugar, contains fat. So for not being diabetic today does not mean tomorrow you cannot be diabetic. It's because of the lifestyle. If you continue doing what you are doing now, there comes a time your body, your pancreas might say, you know what? I cannot cope up with a lot of carbohydrates you are giving me and give up. And now you become diabetic. So even though you are not a diabetic, you must eat healthy. Milk contains a lot of fat. Milk contains a lot of carbohydrate and calories. Okay? So even though you're not a diabetic, milk can make you gain weight. So why don't you start making a right choice now that you're not a diabetic by eating healthy and avoiding those things that can make you become diabetic in the future? Okay? So not being diabetic, you can still eat what you are eating, but make sure you eat wisely. Make sure you eat wisely and make sure you eat proportionally in a smaller quantity. Rejoice, you're welcome. Okay. Make sure you don't go and be eating anyhow. That is the lifestyle we're talking about. Doing anything anyhow, drinking a lot of sugar items. You say, oh, I'm not a diabetic, I can drink Coke, I can drink Fanta. Is the lifestyle. Because those lifestyle you are living now might be your downfall tomorrow and you become diabetic. I say, if I had known that time, I should have not drink a lot of Coke. I should not be drinking too much milk. But now you're a diabetic. So even though you're not a diabetic, you must make a wise choice. Eat healthy, and then exercise. Start from now, eat healthy and start exercising to live a healthy life so that you don't become diabetic tomorrow. So start from now, eating healthy, make a wise decision and exercise, reduce your weight. That is how you live a healthy life tomorrow. But if you keep doing what you are doing now and say, by the way, I'm not a diabetes, I can drink a tin of milk, I can put two spoons of sugar in my tea, I can drink 2 bottles of Coke within 2 minutes or 5 bottles of Coke, fine, you're not a diabetic. But you are pumping your body with too much carbohydrate and sugary items. Those things can cause you to become diabetic. It's like, for instance, I'm not trying to be, there's a word I'm not trying to be biased like those people that have HIV today. Okay? Remember, or those, for instance, HIV, or for instance, okay, I don't want to go that area. Okay, HIV is people that have it today. They made a mistake along the line. It's not a problem. We still love them. They are friends. We might have them as a family member. Though that does not mean we shouldn't love them. We're still going to give them that kind of love. Maybe they've made a mistake along the line, and now they are regretting. If I have listened then, I shouldn't have been in this situation. But I'm going to use another example because of Facebook rules. Okay. For instance, you are a boy. I want you guys to listen. You are a girl, you're a boy, and your dad keeps warning you. Hey, listen, see this guy you are going out with. Be very careful. You say, Daddy, I'm an adult, I know what I know my right, I know not right, I'm wiser. Your daddy keep warning you. Be very careful with this guy. I'm not saying you shouldn't go out with him. Be very careful. And you are a boy, your father, and you are a guy, your father keep warning you. See this girl, be very, very careful. You say, Daddy, I know, we're just friends, this and that, no problem. Your mom keep warning you. Be very, very careful. You say, no. And then you go. When they tell you, your friend tell you, do you use protective? You say, oh, why do I use protective? I don't enjoy it. And they keep warning you, use protective. And when you see yourself, your friend using protective, you say your friend, why are you using protective? How do you enjoy it? Your friend is using protective. And your friend is telling you, I hope you're using protective. You say, why should I use protective? How do I enjoy it? And your friend tell you, I'm using protective. And you say, no. And one day the lady comes to you and say, I'm pregnant. Then your eye open. You as a girl, go and meet your dad at home. You as a boy, go and meet your father at home. Your father is waiting with you a cutlass. You see cutlass? Your father has a cutlass waiting for you. You as a girl, go home. Your father is waiting with you a cutlass. Because your dad has been warning you before this thing. Be very careful. You say, oh, dad, I know that. And then you go. What am I trying to say? You as a boy will have said, if I have listened to my friend and used protective, this girl would not be pregnant. And you as a girl will say, if I had forced this guy to use protective, I won't be pregnant. I'll still be okay. But now you're pregnant. It's already too late. So what I'm not trying to say is that you are not diabetic today does not mean you cannot be diabetic tomorrow. So it's better you start now, living a healthy life, doing everything to make sure you don't become. So those things that can cause you to be diabetic, avoid it. So that you don't regret tomorrow and say, oh, if I had known, I shouldn't have been eating all kinds of food I've been eating. So Marilyn, I believe from the example I give, you should be able to know what I'm talking about. The earlier, the better. Prevention is better than cure. All right, so let's go to the next question. I'm coming to Marilyn. That your question is what I wanted. That is what I wanted to discuss. But I keep answering questions, which is okay. I like when you guys ask me questions so that I know that you guys are following. Let's go to Brian's question. Doctor, please send me the link to your YouTube channel. I have been trying to search for it, but to no avail. Okay. Okay, let me just hold on. Just hold on. Let me deal with this one now. Let me send you the link to my YouTube channel, and then we'll answer the other question. Brian, this is my link to my YouTube channel. This is my link. I've posted the link. Brian, this is my link to my YouTube channel. Okay. I believe you guys can see it. That's my link on my YouTube channel. All right, so let's go to the next question. If you still have issue with it, let me know. If you still have issue, let me know. All right, so let me go to Rejoice. Yeah. All right. Ayoba, you are welcome. You're watching from Nigeria. Rejoice, Brian. I'm trying to see. Marilyn, your question here is, thank you for what happens. I can really use black tea, so I will listen not only to your advice. Sadly, whatever. Okay, Marilyn, your question is what I'm discussing on the drinks. Okay, why still just keep watching the program. The video is one of the what I'm going to discuss as we go down on the drinks you can have as a diabetic. All right, now choosing the right drinks can help you. Okay, why do you have to choose? Why do you have to choose the right drinks as a diabetic? Why do you have to choose a right drink as a diabetic? One, okay, choosing the right can help you avoid unpleasant side effects such as blood sugar spikes. That is, if you're a diabetic, choosing the right drinks can avoid you all those unnecessary headache of unnecessary sugar spike. That is one. Manage your symptoms. There are certain drinks as soon as you put it inside your mouth, you start having that symptoms of diabetics. Either it is high or low. So choosing the right drinks can help you to manage your symptoms. Like for me now, I'm going to give you guys an example. There are certain food that as soon as I put it on my lip, I start having neuropathy, burning sensation in my feet. I have not even through it, just put it on my tongue. Within a second, I start having burning sensation in my feet. And what I have to do was to throw it away and go and brush my mouth. And then look for lemon drink to stop that burning sensation immediately. So that is how I try to differentiate. That is how I try to avoid certain food. So if I'm choosing for the right food, before I eat any food, I first of all taste it to see. If I put it in my tongue, I'll wait for 1 minute and see if I'm going to have effect in my neuropathy. If I don't see any burning sensation, my body is okay with this, I can eat this. But the ones, as soon as I put them in my tongue, taste it, within a second, I start having that numbness in my okay, this food, I'm going to stay away for it forever. I'll throw it away and brush my teeth, look for a lemon to stop that burning sensation. So that is how to manage your symptoms. There are certain food, like for instance, you'll be okay, you don't have any burning sensation, your feet are okay, everything is working, you are enjoying your TV program, you are enjoying with your family. All of a sudden, you eat one thing, and it's like there is a fire on your food. It means that food you are eating has too much carbohydrate. Stop it. Stop it immediately. Don't even go. Just go and clean your mouth and look for something to control that symptom of neuropathy. Because remember, when you are having that burning sensation, you are going through nerve damages, it's destroying a lot. So what you have to do is look for something to stop that burning sensation. Is look for something lemon, or just go for an exercise. Just take a walk, go and jog to sweat it out. And when you come back now, you see that burning sensation is going to minimize. because your sugar level has now come down. That carbohydrate, excess carbohydrate, is now burnt out. Okay, so that is how to manage your symptoms. Now, the last one is maintain a healthy weight. There are some drinks that contains a lot of calories. The more you drink it, the more you add more weight. Okay, so choosing the right drinks will help you to maintain a healthy weight. And how do you choose those drinks? Is to make sure you choose drink that doesn't contain a lot of calories or no calories at all. Okay, even though it doesn't contain sugar, but if it contains calorie, still avoid it, because those calories are going to make you to gain weight. And as a diabetic, you don't need something that's going to make you to gain weight. Rather, you need something that's going to make you to burn those weight out. So that is the reason, 3 reasons why you are choosing the right drinks as a diabetic. 1, to avoid unpleasant side effect of blood sugar spike. 2 is managing your symptoms, and then 3 is maintaining a healthy weight. Okay, now let's look at I'm going to give you guys, we're going to discuss the drinks you can have as a diabetic. Okay, let's go one by one. I've discussed this. I've discussed this before. I'm going to bring in something. Just hold on. I'll be right back. Just hold on. Just hold on. I'll be right back. Okay, number one. All right, number one. Number one drink is called seltzer water. Number one drink you have to look for seltzer. The kind of drink you're supposed to drink as a diabetic is called seltzer water. I'm going to tell you what seltzer water is. So number one drink is called seltzer water. Okay, you can, as a diabetic, you can have seltzer water. What is seltzer water? Seltzer water is a sugar-free alternative. It contains no sugar, it contains no calorie, it contains nothing at all. And what are the examples of seltzer water? Is those carbonated beverages like a soda water. You know those soda water? They are carbonated. You know those soda water, when you open, it has some bubbles. You have to drink it fast, okay, and close it. It's example of seltzer water. Those carbonated water, they contains no calorie at all. They contain no sugar. They're sugar-free. They contain no carbon. Everything is zero. So example of seltzer water are carbonated water. As a diabetes, go for those soda water. Soda water is an example of seltzer water. Okay, so seltzer water example of is soda water. Okay, so soda water is sugar-free, carbonated water. It has no calories, so you can go for that. Okay, it's like a regular water. It's free of calories, carbs, and sugar. Okay, drinking carbonated water is a great way to stay hydrated and support a healthy blood sugar level. So they come in different flavors to choose from. Okay, they come in different flavors to choose from, but I don't go for flavors. I don't choose anything that is colored. I don't go for it because I don't know what is that coloration is. It has to be like pure water. I see the color of water. I have some in my fridge here, the carbonated water. So I have a lot of carbonated water, soda water. Those soda water that you have to drink fast. Okay, so it's example of seltzer water. Okay, so it is calorie free. You have to be mindful of calories. It has to be calorie free, 0. It has to be carb free, carbohydrate free. It has to be sugar free, and no any added flavor or added sweetener in it. So all those things must be out of it for you to take as a diabetic. So seltzer water example is soda water. All right. Now somebody is telling me about cinnamon water. Cinnamon is good for diabetics, but I have an issue of cinnamon water because it says cinnamon water does not mean I have to go and drink it. Cinnamon is good for diabetics, but not because it's written. One thing you guys have to understand about product. If I want to sell a product now, if I say sugar water, nobody's going to buy that water for me. If I say sugar water, nobody's going to buy it. Because if I'm a diabetic and I see this water name as sugar, I'll say, well, I'm a diabetic, I'm not going to buy it. People living with diabetics are more populated than people living without diabetics. So I will look for a name that's going to attract me to sell my products. I will say cinnamon water, because the people say, oh, cinnamon is good for diabetics. Good night, Marcuzin. Okay. So I will say cinnamon water, because when you hear that word cinnamon, people are going to rush that product. And people, when they hear a certain name, cinnamon, they rush without reading the label, because that name will attract buyers. So because it says cinnamon does not mean I have to rush for it. It's a marketing strategy. I will put cinnamon to attract, to sell my product, but because 80% people don't read the product of what they are buying. Some even buy expired product. It's when they go home, they check it, they say, oh, so this thing have expired, because they do not take their time to go through that labeling to see what it contains. So because it says cinnamon sundae does not mean it is good for you. So cinnamon has added flavors and sweetness in them. You have to read the label to make sure that those things, it has no calories. Even though if it says cinnamon and contain calories, stay away from it. It must make sure it is calorie-free, carb-free, and sugar-free, and no added flavor or added sweetener in it. So don't fall a victim of just the name cinnamon and then you rush for it. Read the label. It's very important to make sure that it is calorie-free, carb-free, sugar-free, no any added flavors or added sugar or added sweetener in them. All right. So Sandy, take note. So that's one. Let's go to number 2, tea. Somebody asked me about black tea. Who asked me about black tea? That's Marilyn. Okay. So number 2 drink is tea. I'm a lover of tea. Number 2 is tea. I have about, in my cupboard here, I have about, if I'm not mistaken, I have about 30 different kinds of tea in my cupboard here. 30 different kinds of tea. Okay. Different flavors of tea. Why I'm not gonna, because I think one of the Facebook rules is that last time I did a video and I started showing you guys those tea, they flag it down as if I'm advertising. Facebook will use my video to advertise their product. So they flag me, they warn me that I shouldn't be advertising. I told them I'm not advertising, I'm only just communicating with my fans. They can't talk. They say no. Because once I show you that on the camera, they think I'm advertising that product. So that is why you see, I wanted to go and show you guys example of soda water, and I remember that is why I didn't come with it. So I'm not going to be showing you any product live now on the video, because they want me to stop it. Because Facebook, like in my video now, they would like to advertise on my video to make money for themselves. So when they see me advertising, showing you guys things on video, they think I'm advertising that product. And that company is not paying them to advertise on their platform. I hope you guys will understand it now. So I'm not going to be showing you guys anything anymore, so that they don't close my page. So they want me not to be doing it anymore. So I said, okay. So I told them, they understand, because they listen, they watch my video. All those people, they watch your video to make sure you are following the rules. So I said, no. They said, okay, we're going to let you be now. So I'm not going to show you guys any product more on the video, but tea. Okay, I'm a lover of tea. All right. Now, black tea is good. Tea is one of those things I'm going to mention. As Marilyn, as you said, tea, black tea, lemon tea, garlic tea. What do you call it again? Garlic tea. There's another one again. Green tea. Okay. Alternative, good for diabetics, as long as you are drinking them without sugar and milk. It must be plain. Okay, it must be plain constantly. It must be plain. Like I'm drinking tea now. Okay. This one I bought it from the shop because I stepped out. I went to the gym on my way coming back. I grabbed a tea. All right. So teas are good alternative. Uh, they have a very good positive effect in your general health. Okay. Daily consumption of green tea may lower the risk of type 2 diabetes or manage your sugar levels. So green tea, choose green tea, black tea, garlic tea, what do you call it again? There's another one again. Cinnamon tea. Cinnamon tea. There's another one again. There's a, let me go. And I'm going to go just get the name. I'm not going to show you guys. Let me just get the names of the tea that I have here. Okay, let me go and write them down. I'm not going to show. I would have shown you guys, but because of Facebook rules, I'm not going to show. Let me go and write them down. Let me write them down and show. I'll bring it up once. All right. Okay, let's give you guys about the tea. All right. Number one, we have apple cider vinegar, apple cider tea. Okay. Remember, we have apple cider tea or apple cider vinegar. There are two different ones. Apple cider vinegar tea, okay, or apple cider tea. Two of them. We have chamomile tea. Chamomile tea. We have green tea. That's four. We have green tea. We have ginger tea. Okay. We have cranberry tea. Okay. We have cinnamon tea. That's 6 or 7. Cinnamon tea, and we have the black tea. That's 8. We have the hibiscus tea. Hibiscus tea. That's 9. We have the peppermint tea. That's 10. Okay. So these are the teas you're supposed to take. Okay. You must take them without milk or sugar, plain. Lemon tea also is good. Lemon tea, lime tea. I'm a lover of lemon and lime tea. I drink more of lemon and lime all the time. And one thing with all this tea makes you to lose weight. If you constantly drink this tea all the time, you lose some weight. Okay, so drink a lot of tea instead of. It's a good substitute. It gives you really good realizations and it keeps your blood sugar level in check. Especially the apple cider vinegar tea and the lemon tea. They keep your blood sugar level in check. Now, okay, so those are the type of, we have the tea and we have the herbal teas. The herbal teas, okay, like the chamomile tea, the ginger tea, the peppermint tea, the hibiscus tea, those fall under the classification of herbal teas. They are also good. But make sure if you're buying all those teas from the market, make sure they are the one that have been approved by the government. Okay, approved by the government. So tea and herbal tea. So we have tea as number 2. We have herbal tea as number 3. These are some of, so we've discussed about tea, herbal tea, and we'll talk about seltzer water. These are the kind, and I've given you guys example of seltzer water, which is the soda water. These are the kinds of drinks you're supposed to be going as a diabetes. You must take them without milk and sugar all the time. All right. Somebody mentioned about what about lemongrass tea? Lemongrass tea is good, but first of all, you have to look at the content. Lemongrass tea, one thing with lemongrass tea, if you're buying a lemongrass tea in the shop, read the label. As I said, there are three things you must make sure it has in the label. If you are buying any tea, apart from the lemon tea, apple cider vinegar tea, green tea, ginger tea, garlic tea, those ones are okay. They contain a powerful antioxidant. Those ones, diabetes run away from them because they have a powerful antioxidant that helps to keep your blood sugar in check. Okay, but when it comes to lemongrass tea, read the label. When you are buying tea, all these herbal teas, like you mentioned about lemongrass tea now, there are three things you have to check. Make sure they are calorie free, they are carb free, that is carbohydrate free, and they are sugar free. Okay, these three things are essential in any of these herbal tea you are buying. So the lemongrass tea, you have to read about the labeling to make sure, is it calorie free, 0%? Is it carbohydrate free, 0%? Is it sugar free with no any additional flavor or sweeteners attached to it? So you have to be wary of the type of lemongrass tea you are buying. And it must be taken plain without no milk or no sugar, no any added sweetener in it for you to get the benefit of the tea you are taking. All right. So can sweetener be added to a tea? I've discussed about this sweetener issue. I think we discussed about it. We did a video about sweetener issue. I've told you guys stay away from sweetener. Even though you are going to take sweetener, there are certain things. There's a video I did about sweetener, and I told you guys in one hand I say yes, go for sweetener. In the other hand, I say don't go for sweetener. Sweeteners come in different forms. Okay, sweeteners come in different forms. There are sweeteners that contain calories and carbs and added sugar or flavors in them. Those are not good for you. Remember, I've said to you guys, if you are choosing a sweetener, even though it says sugar free, look at the calorie. Does it contain any calorie? If it contains calorie, stay away from it. Because those calorie is what is going to make you to gain weight. Instead of that, as a diabetic, you're supposed to be reducing your weight and not getting weight. So you're not supposed to eat something that is going to make you to gain weight as a diabetic. So if those sweetener contains added flavor or artificial flavors, stay away from them because they are going to make you to gain weight. Our advice, stay away from sweeteners. Okay, if you're a diabetic, you are not there to take something that is sweet. You are a diabetic for goodness sake. You have to stay away from something that is going to make you that tastes nice. You are a diabetic because of a cause. Drink your tea plain. No milk, no sugar, no any added sweetener in it. Drink it for you to get the real benefit of drinking that tea. Okay, so don't look for a shortcut. Don't look for in diabetes. There's no shortcut in treating or living with diabetes. You have to either follow that direction or you don't. As I said, diabetes is about life and death. You have to choose which one is okay for you. Diabetes is about life and death. You got to make a choice. You want to live or you want to die. If you want to live, there's no shortcut. You go straight to the point. If you want to die, you can do whatever you want to do. All right. So treating diabetics is not a matter of I'm going to look for a shortcut. You got to do something, follow the instructions on those things they ask you not to do. Okay, so Brian Sheila, I believe I've answered your question, Brian Sheila. Okay. So Brian, I believe I've answered your question. All right. All right. Now, let's go to number 4. Number 4 drink is coffee. When you are drinking coffee, I think we've said this several times. When you are drinking coffee, when you are drinking coffee, okay, when you are drinking coffee, I've said it several times. Okay, I've said it. Brian, did you understood my explanation in terms of the sweetener? When you are drinking coffee, you must make sure you drink your coffee plain. Okay, all right. Your coffee must be drunk plain. Now, coffee, There are rules in taking coffee for diabetics. I've explained this before. Okay, I've explained this before. There are people that when they take coffee, it spike up their sugar level. Remember that coffee contains carb also. Coffee contains carb. So there are people when they take coffee, it spike up their sugar level, and there are people when they take coffee, it does not spike up their sugar level. I belong to that class. Now, if you're a diabetics and you want, there are three things you have to understand why as a diabetic taking coffee. In a day, you must take only 1 cup of coffee in a day as a diabetic. As a diabetic, you cannot take 2 cups of coffee in a day. It has to be 1. 1 coffee a day. Write it down. 2, if you are drinking coffee, make sure you go for decaffeinated coffee. Don't go for regular coffee that contains caffeine. You go for decaffeinated coffee. Caffeine also affects your sugar level. That is why you have to go for decaffeinated coffee, the one that doesn't contain caffeine at all. So when you're ordering for your coffee or you're shopping for coffee, look for coffee that says decaffeinated. It means it contains no coffee. Do not go for the regular coffee. That's 2. Number 3, when you're drinking coffee, it must be unsweetened. No milk, no sugar, no sweetener, nothing added to it. Remember that coffee contains carb. Now, if you are drinking coffee, make sure it's unsweetened. No milk, no sugar, no any added sweetener in it. Number 4, take a small cup of coffee. Don't go for a larger cup of coffee because the larger cup of coffee, the larger carbs. Remember that coffee contains carb. The bigger your cup, the bigger the carbohydrate, and it's going to count towards your carb for that particular day. So go for a smaller cup of coffee. So those are the 4 rules why taking coffee as a diabetic. Do you guys want me to repeat it again? Do you guys want me to repeat those 4 rules why taking coffee as a diabetic? For those who wants to join the program live, I'm going to paste a link once more. If you want to join the program or you want to ask your question, download this link in your phone, in your iPad, or in your, download it or open it in your browser and then follow the instruction on how to join, how to enter the studio. All right. So you have to open this. Kumba, you are welcome. So you have to open this. For those who wants to join the program live now, who wants to come on, join the program live, who wants to ask their question in person on the video, download this link on your phone, on your browser, in your laptop, and keep it there. Save it there. That link, that is my link for this broadcast. You can then follow the instruction in how to enter the studio. Okay, then I can bring you in and then you ask your question in person or we have a discussion. All right, so follow that link, open it in your browser, download it, save it, and then follow the instructions. So I've given you guys 4 rules on coffee. Coffee, it must be unsweetened. Don't add no milk, no sugar, nothing. It must be plain, and then go for smaller quantity of it. Honest from Zambia, welcome. Kumalo, Kumba, welcome. Kumba, are you still in the US or you're back in your native country? Let's go to the number 5th drink. Let's go to number 5th drink you can have as a diabetic. Number 5th is vegetable juice. Number 5 is vegetable juice. Number 5 drink you can have is vegetable juice. Okay, number 5 drink you can have is vegetable juice. Okay, vegetable juice are 100% juice. Okay, most of the 100% fruit juice are high in sugar. Okay, most of the 100% juice are high in sugar. So you may want to try something like tomato juice or vegetable juice alternative. When we talk about juice, remember I said vegetable juice. I'm not talking about orange juice. Okay, because most of those juices are 100% high in sugar. So instead of going for those orange juices, go for tomato juice or vegetable juice alternative. You can make your own. When we talk about tomato juice or vegetable juice alternative, it means you can make your own blend. You know, you have the blending machine at home. Okay, you can make your own blend of green leafy vegetables. You go to the market, buy all the ingredients, the leafy vegetables, the celeries or the cucumbers, the berries. Okay, and then add them, put them in the blender and grind them and make your own juice. Okay, so that is why you have to avoid all those 100% juice sold in the store because they are high in sugar. Instead, go for your own alternative, that is preparing your own juice at home. The vegetable juice, you go to the market, buy your leafy vegetables, buy your berries, buy your cucumber, buy your the oranges, you know, apple, okay, and slice it and put it in a blender, grind it and prepare your own juice. That is what we call it, vegetable juice alternatives. Okay, so that is number 5. Then let's go to um, milk alternative. Okay, number 6 is milk alternative. You know, I've told you guys about milk. Stay away. Instead of milk, go for the alternative of milk. We have alternatives of milk. Okay, so what are the milk alternatives? Instead of going for the real milk, you go for the alternatives such as almond milk, soy milk, coconut milk. You know, these are dairy-free and low in carbs. While this is called milk alternatives, that they are dairy milk and they are low in carbs. The carbs in them are not the same as the real milk. The real milk have a high concentration of carbohydrates in them. So if you go for milk alternatives like almond milk, soy milk, or coconut milk, these are dairy free and the carbs in them are low. So still contain carbs, but you have to drink them in minimal. But they are milk alternatives. Okay, and it also contains, you know, fortified nutrients such as vitamins such as calcium and vitamin D, of both which are very key role in your bone health. Those milk alternatives like almond, soy, and coconut milk are fortified with a lot of nutrients such as calcium and vitamin D, which are very important that play a role in your bone health. So these are milk alternative. All right. Now let's go to the next one. We call them green smoothie. Green smoothie. Okay, I'm still in Africa still till after the fasting period. All right. So those are milk alternative. Okay. Okay, Kumba. So you guys have any question? Do you have any question? Do we have any question? So the next one is called green smoothie. You know those green smoothie? Okay, the green smoothie contain a lot of fiber and nutrient into your, you know, the green smoothie are going to supply you a lot of fiber. Okay, because they contain a lot of fiber and nutrients in it. Okay, so always the green smoothie vegetables, you know, we call them green smoothie because they are green, they are vegetables, some of them are root vegetables, they contain a lot of fiber, and you need that fiber to manage your diabetes. And the example of green vegetables, green smoothie, we call them green smoothie. Let me just, what I mean by green smoothie is what I call it. This is what I mean, green smoothie. Okay. So this contains a lot of So that's what I mean by green smoothie, okay? Green smoothie contains, it's going to provide you some extra fiber and nutrients into your diet while staying hydrated. You can use green vegetables such as spinach, kale, and celery, along with some protein powder and a bit of fruit to make a healthy homemade smoothie. Fruit contains carbohydrates, so remember to count them towards your daily carbs intake. So, at least that is why I say to you guys, 80% of whatever you consume should be made at home. If you're diabetics, 80% of whatever you consume, prepare it by yourself. 20% you can get them from outside. Because at least you are taking into consideration your carbohydrate intake. Those things you buy outside, they don't care. They don't even care about they don't even know what is carbohydrate. All they want is to make money. So you patronize them, and that food you are eating contains too much calories in it, too much carbohydrate in it, too much sugar in it, and at the same time, at the end of the day, you are not eating healthy. So that is why I said, if you're a diabetic, 80% of your food should be prepared at home by yourself. 20% once in a while, you get them from outside or from the healthy stores. Okay. So do we have any question before I try to round up? Do we have any question? Because I'm going to have another live program later on today. Okay, in the next 3-4 hours, we're going to come back because it's been a long time we've not done our diabetics forum where we ask questions. Okay, due to my work schedule. So, I'm going to try to come back with that diabetics forum where we can ask questions. Okay, so do you guys have any question? Do you guys have any question before we try to round up? If you guys don't ask me any question, I'll be looking at you. I'll be looking at you guys until somebody asks me a question. I'm going to see who is going to ask me a question. Honest, and I did answer this question when Regina asked me some question. There is nothing like zero fat or fat-free milk. Okay, there's nothing like it. Forget about what is written on it. Forget about what is labeled on that milk, zero or fat-free milk. Forget about it. Those are marketing strategies. If you're a diabetic, you have to make a choice. You want to live or you want to die. If you want to die, you can go for zero fat or fat-free milk. If you want to die, you can go ahead and buy it and eat. If you want to live, you have to avoid all those zero fat or fat-free milk. Honest. So it's a choice. I've said it several times, and I've said it several times. If you want to die, if you want another man to look after your wife and your kid, go ahead and buy zero fat or fat-free milk. You are okay. If you want to live for your wife, live for your kid, and be alive to see them grow, then stay away from all those zero fat or fat-free. There's nothing like it. Those are marketing strategies. There is nothing like zero. There is nothing like fat-free. Those are marketing strategies. Okay? So it's a choice you have to make. That is why they say diabetics, you must eat healthy. You must make a wise decisions. So it's a choice you have to make. All those things are marketing strategies telling you it's a zero fat or fat-free. No milk, every milk contains fat. No matter how you process it, it contains fat. That is why they keep warning you, stay away from milk. Yes, milk contains some nutrients that you might need, but that occurs when you need it specifically. As long as your body have those nutrients, you don't need to be consuming milk, especially when you're a diabetic. Milk is going to mess you up. So stay away from, I don't know why, I think Regina asked me that question. That was the first question Regina asked me today. Africans, especially Africans, they like milk so much. Even if they are dying on their dying bed and doctors say stop taking milk, they would like to go and take milk. I've never seen African. I'm an African. Okay, so I'm not trying to be prejudiced. Africans like milk so much, even if that thing is killing them. No matter how you try to tell an African this milk is not good for you, you find an excuse. You find one excuse so that you can back him or her to go and take that milk. No matter how you try to tell an African milk is not good for you as a dad, an African will try one trick or the other to give you an excuse why he or she will want to take that milk. Why? I've told you guys, if you're a diabetic, stay away from milk. Sacrifice milk for your life. It's a choice. Okay, milk contains a lot of carb. They are high in carb, high in calories, high in fat, and then they tell you it's zero fat or zero no fat. There's nothing like that. Just so it's a choice you have to make. Honest, you got to make a choice. You want to live or you want to die? Choose one. I don't drink milk. I stay away from milk because, and that's the difference. You got to try to make a wise decision. Stay away from milk. Period. Okay, it's a choice you have to make as a diabetic or not. No, I'm not. Yes, I know. I'm not trying. I'm not trying to. It's not a reputation. I'm only advising you. Somebody have asked me that question before. I'm not. It's not a reputation. I'm glad to answer your question, honest. Okay, I'm glad to answer your question. You are right. You have every right to ask me any questions, and for me to explain it again and again and again. So it is not offending me. Okay, so don't take it personal. I'm only just saying in general. I've answered. You are not the only person. Everybody, even emails I receive, people will still come back and ask questions about milk. So I'm not taking it personal with you, honest. I'm glad to answer your question. It's not a reputation. I'm only just saying it in general. I've answered this question a couple of times. I can't remember. Even as you ask me this question now, another person is going to come to ask me the same question again, and they are listening. So what I'm trying to say is that the message I'm trying to pass across is that, okay, I don't know why we Africans, I'm an African, so I'm the same place where you come from. So I'm not trying to be prejudiced, say, oh, why this guy's criticizing an African? No. Africans, we know our problems. Okay? When you tell them not to do something, they will do it. So what I'm trying to say to you as honest is that stay away from milk. As you're asking me this question, another person is going to ask me the same question. Again, just watch it. Somebody's going to ask me the same question again. Even though I have explained it to you, say another person is going to come, find another excuse to take milk. Africans like milk so much. Africans like sugar, like milk. I know that for a fact because I come from that region. Africans like milk, like sugar. So even if you are telling them, stop this, you are just wasting your time. As soon as you move away, they go and take that sugar. So what I'm trying to tell you, honest, is that I'm not being offended. I'm glad you're asking me that question. You asked that question because you want to learn, and I'm glad that you want to learn. Okay, so don't take it personal. I'm only saying, in general, is milk is not good for you as a diabetic. Period. There is nothing like zero fat or fat-free. And I've challenged everybody, and the same thing I said before. Show me one milk. Show me one milk that says it doesn't contain carbohydrate or calorie or fat. Show me one milk that is meant for diabetics. That they say this milk is for diabetics. It doesn't contain calorie, fat, or carbohydrate. None. So stay away from milk, honest. That's my own advice. Stay away from milk. Whether it is fat-free or zero-free, stay away from it. It's a choice you have to make. So don't take it personal. I'm not taking it personal. I'm only saying it general to everybody that can hear me. Stay away from milk. Milk is not good for you as a diabetic because it's going to worsen your situation. So do not take it personal. I'm not taking it personal. I'm only saying it that as you ask me this question now, I believe you in the next 5 minutes, somebody's going to ask me the same question again. And with another reason why I should approve it for them to go and take that milk. So that's what I'm trying to say, that milk is not good for you as a diabetic. So I'm not taking it personal. Your question is welcome. and I like it. It's not a reputation, but I'm only saying it louder for everyone to hear. Stay away from milk. If you're a diabetic, it's not good for you. All right. I believe I've answered. I believe we understood each other now. Okay. So let me know if you have any other question, Honest. All right. So what other question? I'm waiting for other questions. Honest, I believe you answered your question. You're okay with the response? I'm waiting for question. Are you there? I'm waiting for your question. So you guys can keep me busy. I'm waiting for your questions. If you have any question. All right, Honest, you're welcome. All right. Where are everybody? Everybody's quiet. People, I'm here now all day with you guys. So, today I started early because most of the time they say, oh, you always come late when it is late wherever you are. People are going to bed to sleep. So now I'm early. I believe I'm here. I have all day to discuss with you. So you guys should keep me busy. Except you guys don't have much to say, then I'll end the program and come because I have another live. We're going to do another live program later on. Okay, in the next 2-3 hours. Oh, Jesus. In the next 2-3 hours, we're going to have another live program today again. So, you guys have another question? I don't know why I'm sneezing today. I don't know what is something is wrong. Something. Okay, I'll be right back in 2 minutes. In less than 2 minutes, I'll be right back. Let me go and I don't know why I'm sneezing. All right, so let's conclude this program now. If no any other question, we're going to conclude it now, and then I will be back we'll do another live program later. So let me see. Okay. Do we have any other question before we conclude this afternoon program this morning? Because I'm going to come back in the next 2-3 hours again for another live program. So let's conclude and then get ready for the next live program. Now, I've shared a link with you guys. Okay, then the next program we're going to have in the next 2-3 hours, we're going to have another live program. I shared a link. You guys should save that link. The next program, I'm going to like everybody to come online. Okay. I would like everybody to join the program live and share their story. Let's share our story about diabetes. Okay. About how your experience living with diabetes. Okay. So I've shared the link. Download it on your phone. Open it on your phone, on your laptop, on your iPad. Have it there ready. On the next program, it's going to be, I would like everybody to come in, join the program on the video, and share your experience living with diabetes. Okay, that is what I want to do next. There's a link. I've shared it already there. So open it on your browser. Keep it. On my next program, I'm going to title it, I want you to come in, even if it's for 2 minutes or 3 minutes or 5 minutes, and share your story about living with diabetes, your difficulties, your good and bad about diabetes. Let's everyone talk about it. At least 2 minutes, 3 minutes. If you want to stay longer to share your experience, the difficulties you're having about living with diabetes, then you can share it. So it's going to be a live video. It's not going to be question and answer. I'm going to share that link once more. This is the link. Have it on your phone. Download it. Open it. In my next program, I want you guys to come in and then spend 2 minutes and share your thoughts about the experience living with diabetics. Okay, I want to hear it. I want to let everybody hear about your experience living with diabetics. So you have to join the program live. Okay, you have to join the program live to share your experience of living with diabetics. So make sure this is the link. All right. Once more, this is the link. I've shared the link. Open it in your browser, download it in your browser, in your phone, in your iPad, everything. Keep it, save it. So once I come back live, okay, there'll be no question and answer. I want everybody to share their experience with me, discuss it. Let everybody hear. Let's see how your experiences with living with diabetics. Okay, that is what we're going to do next in the next 2-3 hours. So that is the link. You have to join the program 2-3 minutes. Okay, and then let everybody, share. Let the community know your experience right from day one, living with diabetics, how you manage it, what are your goods and bad. So that is what we're going to do next. So that is the link for you here. Coming up in the next 2-3 hours. So make sure you have that link, save on your phone, open it on your phone, in your laptop, in your iPad, in my next program in the next 2-3 hours. That is what we are going to do. Okay. So in the absence of any question this morning or this afternoon or this evening, depending where you are, all right, I'm going to say you guys have a wonderful day until we meet again in the next 2-3 hours. Our next program, okay, let me put it here. Next live broadcast in the next 3 hours. So I'm going to let you guys go now. Thank for those that have joined the program now, and hoping to see you guys in my next broadcast. Okay, make sure you have that link on your phone, on your iPad, on your laptop, ready to join the program. The next program is going to be call in. You go to call in. You go to call in. We're not going to be. I'm not going to be answering any question. I want you to spend 2 minutes or 3 minutes. You call in and then share your experience about living with diabetics. That is the link you have to join. In my next broadcast coming up in the next 2-3 hours, there'll be no question. I want everybody to come in and then share their experiences of living with diabetics. Let the community know, let the fan base know how you are struggling, the ups and downs about your diabetic situations. Okay, so that is what we are going to be having in the next 2 to 3 hours. So have that link, save on your phone, download it in your browser, and have it handy. Once I come live, I will not be entertaining any question. I want you to join the program, enter into the studio, and then share your experience. Let the community knows we are here to share experience. Your experience might be good for somebody that is living with diabetes. So when you speak out how you manage your diabetes, what is working for you, the difficulties, you are sharing it for another person in another world to learn from you. So that is why the next program is going to be call in. Make sure you are ready. I will not be answering any question. I'm waiting for you to call in, join the program live, and then spend 2-3 minutes, 1 more hours. All right. Brian, Brian, you're welcome. Can you hear me, Brian? There's a noise at your background. How are you?
I'm just testing.
Oh, okay, nice. All right. Yeah. Okay. It's like you're home today. You're not at work. Can you hear me? Can you hear me? Your audio is not clear. I can hear your background noise, but I can't hear you. I don't know if you can hear me. Your audio is off. Your audio is off. Can you hear me? All right. Okay. It's good you test, Brian. It's good you tested. You test the link. So that is what we're going to do the next live video. All right. As I was trying to explain, okay, your experience, your ups and downs as a diabetic might be good for somebody else. Not everybody is conversant or knows about diabetics. So we're going to have a call-in program in the next video where everybody is going to call in, join the program live, and then share their experiences, ups and downs, on how they are managing their diabetics. Okay, so that's what we're going to do, because your experience might be good for somebody else. So let the community learn from your experience on how you have been managing your diabetics. So that is why that is what this page is all about. It's a community. All right, it's a community for diabetics. All right, so in the next video coming up, in the next live broadcast coming up, we're going to have that. Okay, so let the community understand your situation, how you are handling it, what are your ups and downs. Okay, remember your experience might be helpful for the government that are watching, because a lot of people watch this program. So somebody might be watching and listening to you, and then you are in that country, so they might learn from you to start something in your country to help you out. Okay, so your experience, your thought, you're sharing your thought here might be a catalyst for your government to start doing something they've never done before. All right, so you have to speak out. They watch all these programs on the internet and know how to provide a solution. So in the next live video, that is what we are going to do. We are not going to be answering questions. You're going to join the program live, save that link on your phone. The link that is there, save it on your phone, open it. So once the program starts, all you have to do is to enter the studio and then take your time and share your experience. Okay, whatever time you want to take, share your experience. People are listening. You might be of help to those people. Okay, so that's what we're going to do in the next video. So I've said enough. Let me let you guys go and get prepared, and then I'm going to see you guys in the next 2-3 hours for the program. All right. So Brian, hope I will see you when the program starts. So once again, I thank you guys for watching this first broadcast, and I'm going to see you guys back. So stay blessed. I love you guys. Bye-bye. Bye.